basically, okay. The entire focus of discussion today is to give you an overview on what gaps are present in the healthcare industry and how various entrepreneurs can exploit that particular gap and really make a lot of money in that. Before I begin, I'll just share with you what our headings would be, or on what particular scope we would be discussing our presentation today. I'll share with you a brief background as to why healthcare is so important and why it cannot be ignored. And the scope of discussion will revolve around the areas of human resources, care, basically patient care, knowledge for both patients and the medical fraternity, information technology and how we can leverage that in the healthcare sector, regulatory environment and how that creates a huge opportunity for everyone to exploit that particular thing, quality and accreditation, documentation requirement, which leads to a lot of aspects where we can do a lot of things and help hospitals and insurance sector, marketing and patient acquisition strategies, social media marketing and various other marketing strategies, which can be a aspect which will require a lot of entrepreneurs there. Equipment maintenance, all the sonography machine and CT scan machines which are worth crores of rupees in any hospital. We need professional organizations to maintain that. Customer engagement, now it's a trend in the next 2-3 years where a patient will no more be a patient, he will just be a customer. So we need to have various people to have customer engagement activities. And finally, the trends in what niche services are coming out. Yesterday it was all hospitalization. Today it is all about ambulatory care and daycare services and standalone clinics where patients need not get admitted for 24 hours. So we talk about all these things. Taking the presentation forward, the background is that the healthcare industry in India is about 6% of the GDP. It's the second largest in the world, and out of which 80% is private spending. Only 20% of people use government-aided services. The rest of it is all in private healthcare setup, and that is what is a good news to the entrepreneurs, because patients by and large look forward for services in the private healthcare setup. Because the other 20% is more related to poverty, poor people, and various schemes which are basically cross-subsidizing or giving free services to them. There are huge tax breaks for various hospitals now. If you are a 100-bedded hospital, you get a tax break. If you are in northeastern sector or various Tier 2, Tier 3 cities, there are certain designated locations, you get 100% tax break for more 5 years or so. There is a huge rising middle class population, which is 63% of the total Indian population. The disposable income is increasing on a year-over-year basis. So people earlier who are not looking out to go to hospitals or doctors or keeping at home and not giving importance to healthcare, suddenly a huge population has come forward. There is nobody to address that particular population. Increased mobile phone penetration and accessibility, and people are hungry to get information and knowledge right from patients to the doctors. The huge aging population, because the average life expectancy has increased, which was earlier 58, 62 years, has now become 68, 73 years, and that entire segment is a niche segment which could require home care, etc. And we need a lot of help there. There is a huge penetration issue in insurance. It is total insurance reach in India is less than 1%. Only 1% of Indian population has any kind of Mediclaim, and if you consider all kind of ESI schemes and reimbursements, it is not more than 2 to 4%. So, and there is a huge scope of insurance sector increasing there, and there will be a huge requirement of professionals to cater to various aspects of services in related to Mediclaims. Implants and devices presently are largely imported, and government schemes and policies are changing, which will require a lot of innovations within the or which will encourage a lot of innovations there. So it leads to a lot of opportunities there, and which you may just find a very negative, is a great opportunity for the for the entrepreneurs looking in coming into the healthcare sector, is an increasing regulatory stringent environment. The clinical establishment bill has finally been passed. All the state governments will implement it. All the hospitals will require to register themselves. Only few cities in this country have to register their hospital. Quality consciousness is increasing. There are hundreds of licenses which you want. There are documented 67 licenses at present which a hospital requires. There's a huge regulatory environment which is there, and there is nobody to help hospital providers or healthcare providers to actually get them. So this leads to a lot of opportunities where people can help get a regulatory environment to cater to this increasing regulatory environment. So taking the opportunities forward, we'll start with the crux of any industry, which is a human resource. And to begin with, I will only mention that there is a shortage of more than 5 to 10 lakh doctors at the moment. There is a shortage of 10 to 20 lakh nurses. There are millions of skilled front office and support staff which are required. And with the professionalism coming into hospital setups, customers requiring better professional care, better appointments, such front office, billing staff, and all such staff is required. And there are no such vocational courses at the moment. There is there is a huge opportunity for people to actually say entrepreneur cannot create a doctor because it is highly regulated. It will come out from medical colleges. But there is a huge dearth of these vocational skills also which entrepreneurs can actually look at. They can create front office staff, they can create the ward assistants. There are so many aspects to it in which there is no graduation or anything required, and such staff such staff are in the numbers of 2 to 3 million at the moment as of today. There's a huge problem with sourcing staff because, as I said, there is a dearth of lakhs of doctors and nurses. So hospitals actually are desperate to find qualified people. So recruitment agencies specializing in healthcare is a need of the hour. So if entrepreneurs want to look into the aspects of recruitment, creating databases and sourcing such people, it will be a great help and a great earning opportunity. Training aspect, a lot of hospitals ad hoc recruit a lot of front office staff, etc. And as I said earlier, you can train them. You can train the nurses to make them better qualified. You can train the doctors to clinically make them more qualified, in the sense more trained, and thus their quality of care would improve. There are no professional agencies in this country which looks into a post-recruitment training on a professional front. The EBITDAs in healthcare industry for hospitals is about 12 to 14%, which is among the lowest in this industry. And the professionalism is slowly creeping in into the healthcare industry, and people are looking for trainers and qualified people and organizations who can train these people after they have been recruited. Education, which is basically distance learning, is a 5,000 crore market in this country across all industries, and it is growing 10% year on year, out of which healthcare will be the largest single industry requiring such facilities. Presently it is IT, it will be healthcare in the next 2 or 3 years. So it creates a huge opportunity to provide online content, web-based seminars like what we are doing right now for doctors and nurses and vocational aspects, and it creates a huge opportunity. Outsourcing of manpower like cleaning staff, housekeeping staff, ward assistants, kitchen, dietary services, pest control, which were in the oblivious domain just 4 to 5 years back. Suddenly now every other corporate hospital now has a professional kitchen like Sodexo or Taj. Even typical industries which were catering to the tourism and luxury segment are now coming into healthcare, which includes Taj and Radhakrishna, and all such people are diversifying and coming into healthcare. So it creates a huge requirement where the hospitals and the management of the hospital is interested only in catering to the core services, which is the patient care, and the rest of them they want to outsource. So it leaves a lot of professionals in that area. As I said, aging population is increasing, elderly are increasing, so we need home care staff for the aged and bedridden who really can't afford on a constant basis to be at a hospital. So, but we need certain ancillary staff who can go home and take care of them and coordinate with the doctors from time to time. HR administration and payroll is another thing where because it is not a core activity for a hospital, but giving them a professional insight, managing their salaries and accounts, etc., is something which is in the vogue, which is coming into healthcare. Employee satisfaction, ESOP management, welfare, and packages are other things which healthcare industry is seriously looking into, especially in the aspect of hospitals and hospitalization. This was related to huge list of the opportunities there in HR. I'll be going to the patient care related opportunities. As the patient education or awareness and patients are becoming insightful, that is on the rise, and there are already a regulatory framework in place, which is the clinical establishment bill which has been passed. Insurance is on the neck of hospitals to validate their billing and say that, okay, whatever treatment was given, the bill only will be given for that. So basically, the aspect of validation of clinical care and performance-based costing or performance-based payment to the hospital is coming slowly, and it leads to a huge opportunity where outcome-based care costs will be the norm, and we would need people to validate the same, because what insurance will not accept what the hospital just says that, okay, I have performed these services on the patients and I should be billed for that. No. This is going to be primarily outsourced, and we need people where they would be coming in with expertise to validate what hospital is saying was actually done. Hospitals need insights into creating very intelligent and cost-effective packages which can attract people, where the trend is that patients demand an all-inclusive kind of a cost, where whether it is consumables or medicines, they want to know before they get hospitalized that this is the maximum amount they are going to pay. So it requires a lot of insight and experience and knowledge which will help the hospitals or healthcare providers create an all-inclusive procedure package, and that is a huge opportunity for entrepreneurs there. And as I said, it is not just about what you did, it was also about the kind of quality of care you need to do. So clinical outcome measurements and audits of various clinical services is on the rise, and we need professionals to audit that from time to time, and insurance will more or less soon make that mandatory. So it is like if you want to go and get a loan for your business, you have a financial feasibility report. Similarly, if you want to get your TPA claim reimbursed by the insurance, you would need some kind of a professional to say that yes, the care was provided as per what was required for the patient. This was related to opportunities in improving care, and we would require a lot of people to validate that. Going into the opportunities related to providing knowledge, patients want to be aware of various cost comparisons, why a particular procedure has been advised by the doctor. Time is gone when they depended blindly on their general practitioners, and it is a known fact, and patients are aware today that general practitioners charge anywhere up to 60% of the referral fees. Ultimately, that comes out of the patient's pocket. And there are many stories where a patient says that I went in for an X requirement of a particular treatment, and I ultimately underwent something else. So the patients want knowledge about disease information, about pros and cons of a particular surgery. They want better engagement with the doctor. And all said and done, it is a fact, because there is a huge dearth of doctors. Doctors won't have time to explain all this to the patients. They won't have more than 5 to 10 minutes for the patient. Otherwise, there will be a huge queue outside their OPD consulting rooms. So there will be somebody else who will be doing this. There will be counselors, there will be online content, or there will be in-house outsourced professionals who will be engaging with the patient to tell them about all these queries. So similarly, a doctor needs to update his knowledge, update his skills from time to time. They also need that information. A nurse needs to improve her skills. She needs to know what are the newer trends of patient care. She needs to use tools like quality management checklists and so many other information which is not easily available in an organized format and which can be provided to them. Online medical education as a refresher and an update is what I'm trying to say. Trends in clinical care, benchmarks, a database of medicines, alternatives as to if there's a medicine which has been prescribed by the doctor, if it is 1,000 rupees, a patient would want to know if it is available for 50 rupees in some other brand. So these are the things, and there are companies which have already embarked on such things. For example, the All India Chemist Association has already been funded by Mumbai Angels on that same aspect, where they're creating a database of medicines where you just send a simple SMS and you get an alternative drug name. It's a huge entrepreneurial initiative, and government is showing serious interest there, where they would reimburse them. So like this, knowledge is something which is very important today, and people are looking at that. Patients are looking for cost comparisons. They want to know if X hospital where I want to get a particular procedure done is asking for 2 lakh rupees. Can I get it in the same quality and similar environment for 1 lakh rupees? So there is a huge opportunity to provide information related to cost comparisons. There is a huge opportunity where a hospital would want to improve their profitability by reducing cost bleeds. So they are looking at professionals to help them do costing exercises, look at their utilization rates, look at where they are not performing well in terms of operational planning, etc., and help them improve profitability there. And in the end, for knowledge it is a known fact that the doctors in India or the medical staff in India, including nurses, are very poor bloggers. They don't contribute too much of their learning to the society. If you go on journal search, or if you go on research search, it will be mostly European and Americans or even Israelis who would be writing about their experiences or their case studies or the clinical outcomes. It is a very poor scenario in India. The problem is that they don't have time, because they see a lot of patients and they don't have time to do this. If a professional or a consultant or an individual entrepreneur can create this particular service for the doctor, where they will acquire the data from him and they will create the journal entries and they will create a report for them, and then he can publish it. It is a great opportunity for them. It will improve their branding, it will improve their professional acumen, it will improve their peer respect. So I would request Nurture Talent to allow me a 2-minute break, and then we will come back. Amit, I hope this is fine.
Yes, Akash. So for the audience, Dr. Akash has taken a break. Can we have some of the queries that you have up till now? You can raise a hand or send us the question in the question bar. Yes, Bhumika, you seem to have a question. I'll put you on. You can ask the question to Dr. Akash. Bhumika?
Hello.
Yes, we can hear you.
Yes. Hello.
We can hear you. You can.
Yeah. My question is, how can a biomedical engineer can
Bhumika,
help in this, like providing. Hello. Are you listening to me?
Yeah,
Yes,
yeah,
Bhumika,
Can you hear
I
me?
hear you.
Hello?
Yeah, yes. Yeah, go ahead.
Yes, my question is, how can a biomedical engineer can help providing knowledge to the patients or other members?
Okay, I have a specific
Got
section
my
for you
question?
if you noticed in my, can I answer this?
yes, please go ahead.
Can you please repeat it?
Yes, Akash, please go ahead.
Yeah, okay. There is a specific section for the biomedical engineers here because I expected them to be here. Just wait for that particular section. I would answer your queries there. Yes, there is a lot of things which the biomedical engineers can do.
All right, we have a couple of other questions.
I think we can move ahead
Can you hear me?
with the next questions and we'll come back.
So we have,
Yes, okay, Father. Yeah, please, you can ask the questions.
yeah, Dr. Sunil Pranav has a question. Dr. Sunil?
Yeah, okay.
Dr. Sunil?
Good evening, sir. About the documentation thing you had mentioned. So there is already ARD like medical record important. Yes, sir.
See, I'm coming to those sections. I would request people to have questions related to the slide I have mentioned. If I'll just repeat the slide which has.
Okay, sir. Okay, fine.
Okay,
Thank you,
we have covered HR care and knowledge. I will be coming to the documentation and equipment maintenance part, and I will touch upon that.
All right, Dr. Akash,
Can we go ahead?
Yes, sir. Doc, Dr. Akash, you can go ahead with the slides.
Okay. Covered HR care and knowledge. I'll be talking about IT at the moment. I think there were queries related to documentation and equipment. I'll be touching upon that just about in a while. Just hang on. Okay. I'll talk about IT first. Today, as I said, that the mobile phone reach has increased, and there was a recent survey conducted and was presented also in Times of India. More than 50% of people now have mobile telephone use, and it is a myth that even that the mobile phones are not used for information knowledge sharing in the rural areas. That is not the case today. The agricultural products or the weather reporting for harnessing agriculture, etc., is very well in vogue. It is just a matter of time that somebody uses that for informing various people in the provider sector or the patient sector. So IT is going to create a lot of potential for entrepreneurs in terms of IT-enabled education, as I informed. The knowledge is something which people are looking for. So to facilitate that, you need information technology, and it can be best provided by phones or through computers for distance learning or alerts. Government's huge interest in integrating the public health centers for centralized monitoring is a well-known fact, so that they want all the information for data mining, for ensuring that the funds which they are allocating to the government hospitals are reaching the right people, and therefore the IT is playing a huge role. For example, in South, there is a beautiful scheme called Arogyashri. In Arogyashri, the poor people have got certain colored coded cards, and it's called as Arogyashri cards. And they have empaneled hundreds of hospitals, private hospitals, where these people can actually go show the card and they will get their service for free. It is basically a government-sponsored insurance, and no questions asked. The hospital is paid in 15 days for the treatment provided. It could run in lakhs, but they have a pre-negotiated rate, and it's an all-inclusive rate. So a bypass surgery would have X amount, angioplasty would have would have an X amount and they would be charged only that. And it is running beautifully. And now there are hospitals which have more than 60% or 70% of capacity only catering to Aarogyasri hospitals in private hospitals, and they're earning so well. How is all this mitigated? How all these hundreds of hospitals are catered to? It is all through a standardized software which the government has made, and it is all connected through the IT platform, and the regulators there know what the billing is, and they come to know the trend. They can forecast how much hospital would need to be paid, and the checks are made through an electronic clearance. Everything is done. It is all IT, and it is doing very well. More than 1,000 crores of business is done in Aarogyasri every year. So this is the kind of edge the IT has. They also want to monitor national health programs, how polio vaccines, how many were given, measles vaccines, how many were given, what were the outcomes. There's a huge requirement in the field of site healthcare workers who are going door to door in the rural area or on the houses to check for malaria, fever. There are many states which have given them PDAs and small mobile devices in which they can log in the data which they found, and it all gets online. A census which was done recently was increasingly IT enabled, and this is related to the public health sector. When it comes to the private health sector, the pay per patient software is in the vogue, and any entrepreneur who wants to exploit this will be providing software for free to the hospitals, and the doctors love everything free, and patients love everything free. So if you have a nice software which is cloud-based and you can give to the hospital, now the bandwidth has increased, so you can just provide on per patient use, or you can have a monthly subscription fee, etc. And the hospital need not invest in expensive servers or softwares or IT maintenance people, and this can be all done through IT. And their online lab results are already in vogue, but a lot of smaller nursing homes, a lot of smaller labs don't have this. So again, if somebody can provide a cloud-based thing for them, which can be on a subscription based or a per report basis, which they can deduct from the patient's revenue itself, will be a great help to them. So it's a huge opportunity for entrepreneurs there. Patient records archiving for patients and providers. Today, millions of pages of documents of medical records are lying in the medical record department, and there is a huge pest problem, and the space problem is there. So if somebody can just scan that, digitize that, use optical character recognition if possible, and free up space, because a hospital can destroy those documents legally within 3 to 5 years. So what do they do after 3 to 5 years? So they can actually scan this, and that record is there for posterity. You can do retrospective research. You can do so many things. The entrepreneur can help them do all that. A lot of doctors, independent doctors, and even smaller nursing homes have a problem that they don't have their own website. I think this is a very cost-effective and an easy entry for any entrepreneur who wants to do this. Just create a niche, small website at a very nominal cost and give it as a domain owned to a doctor or a small nursing home, and that leads them to a business opportunity online. Transcription, where whatever the doctor has written needs to be typed. Either that can be done through an optical character recognition, or it can be created through a BPO, where you can have that scanned when somebody types it, and there are various BPOs who are already doing that. Discharge summaries and electronic medical record is a huge opportunity, because now patients want a typed discharge report when they're moving out, especially in the larger corporate sector hospitals where they need to safeguard their image. They just can't give any handwritten note. They have to type it. Then again, there's a problem. So you need, if you can have it heard through a phone recording or something where a doctor speaks in, and you just hear that out and you type that in and you just give it back, a 3-4 page discharge summary. It's a huge opportunity, and help them create some user-friendly softwares, or enable certain aspects where basic data of hospitalization of patient when they're there in the hospital is captured electronically. Will be a great help to the hospitals. Analysis of productivity, customer insights, cost bleeds, reduce poor operational cost burdens, average length of stay, infection control rate. There are in National Accreditation Board, there are more than 65 parameters which they need to monitor, and it is on an increasing trend which they need to do that. So if somebody can help them through IT to monitor all this, and somebody just feeds that in and they get ready-made statistics, it is a huge entrepreneurial opportunity not heard of at the moment. Telemedicine, radiology is already there. You need more such things to be done. Online consultation has started at a vogue. There's a huge gap still there where the entrepreneurs can come in and provide online consultation to the doctors. And today it is not just about MBBS doctors. Today a lot of patients want alternative medicine consultation. It is about homeopathy, Ayurvedic, naturopathy. There are so many things which a lot of people with their mobile phones, BlackBerry, they just have cough, cold, fever, and they're really getting irritated. They can just use their BlackBerry, just start talking to a doctor, and he gets treated. And it could be a subscription base. There's a huge entrepreneurial opportunity there. Online appointments is something which can be provided to nursing homes and hospitals, where a patient can book his appointment with the doctor online and reduce the calls to the hospital for booking the appointment through phone, or wait in the line to book the appointment, and everything can be done like an e-ticketing, which will really help the hospital. BPO service for follow-up for the patient after they're discharged, after they've gone. And analytics saying that so-and-so patient did not come in the last 3-4 months, it is a potential loss to the hospital. So following up with that patient, asking him how he is, etc., or support to the patient after he has been discharged is a great entrepreneurial opportunity for various people. Mobile utility application for nurses, doctors, and patients, like how to calculate my BMI, or how to calculate various drug dosages for the nurses, how to dilute a particular medicine into the saline which will be put into the patient. There's a huge calculation which goes into it. It is very, very complicated stuff. Patient just goes in and he gets pricked. It sounds so easy, but before that there are a huge load of calculations which go into, depending on weight of the patient, age of the patient, as to what and how many drops of saline should go into a patient per minute, so that it should end in a particular hour. It requires a huge complex calculation. If there is a simple calculator which can be given to the nurses on the phone, it will be so much easy for them. So this was in a nutshell what opportunities are there in IT. I'll be going into the opportunities provided in the regulatory framework. Today, with the clinical establishment bill being passed, every day there are newspaper stories on how the nurses are complaining to the police that their certificates were taken by the hospital. They can't do that. The bonds are illegal. They can't hold them back. And then registration in a city like Bombay is compulsory. There are some 65 licenses which a hospital requires. And a person who wants to start a hospital, especially nursing homes, they do not know how to do it. They have to bribe a lot of people at multiple levels. If somebody can come and create a service of just license coordination to just start a hospital, which would include Shop Establishment Act, which would include income tax, PAN card, which would include hospital registration, which would include explosive license, which would include diesel pollution license for the generator, which would include your radiology BARC license to run an X-ray machine. There are some 65-70 licenses. It takes a lot of time, and these licenses again have to be renewed from time to time. Some are 1 year, and then there are reports which have to be sent to all these people every year on the usage and compliance. And there are blood bank FDA license. Recently heard that Jaslok's blood bank was shut down because it could not comply to certain regulatory thing. There are a lot of things. So some entrepreneur can actually provide services which can help the hospitals get these regulatory clearances very easily. Now the hospital also over a period of time would become more LEED or green conscious. So there are architects who want to come into a hospital scenario, or there are entrepreneurs who can coordinate with architects and have LEED. They can actually consult hospitals to provide a greener environment which there is a huge demand there, especially from the larger corporate hospitals. There are various such regulatory aspects, keeping in mind how the scenario is changing now. Moving on to quality. The quality consciousness has really increased. The National Accreditation Board was formed because of that, because the patients were demanding that. There was no ownership on quality. A patient would have just gone in, and there would have been no ownership as to what kind of compliances or treatment or infection control or such things were happening. Today, Quality Council of India, under the President initiative, has created National Accreditation Board for hospitals and healthcare standards. These run into 500 odd standards, which need to be followed by hospitals who want to now, who will showcase that, okay, they have been certified by NABH. It's a rigorous process, but there is a dearth of people to teach them how to do it, to make them understand how these standards need to be interpreted and implemented. So this particular aspects of making hospitals understand NABH is something which is a huge opportunity. ISO standards also is another opportunity. Malcolm Baldrige standards is another opportunity which will improve the leadership aspect of the hospital, the quality and operation of the hospital, and ultimately that hospital will become more profitable because they would have followed every good quality benchmark for the hospital. There are various opportunities now available because the government has taken an initiative to make various public government hospitals also ISO certified or IPHS standard certified. So there will be a lot of consultants required who would have to go there, or a lot of doctors or trained personnel would be required, which have to be given to the agencies who have been hired by the government to go and monitor or implement these standards there. And there are hundreds and hundreds of hospitals who are undergoing at this moment these particular standard implementations. These hospitals, once they have standards implemented, you need to monitor that, you need to audit that, you need to have an unbiased external audit. So you need professionals again to go and audit that and give a report to the hospital from time to time that your standards are being maintained. Corrective action, preventive action follow-ups are required from time to time, and such support has to be given to the hospital, and there is a huge entrepreneurial opportunity there. So this in turn is something which the hospitals can benefit if some professionals are there in this particular segment. Going into the documentation need, and there was a question there, is MRD and documentation, all such things. There is a huge number of medical records which is created. ICD coding is going to be norm over a period of time. Insurance regulatory body, the IRDA, is already creating a software for ICD coding which they're going to give away for free, but nobody would know how to use it. So there is a huge entrepreneurial opportunity to train people on how to use ICD coding, or to create softwares which will interpret symptoms into ICD coding, which can be used onto the medical records. And before and now, because insurance and TPA is there, a lot of files have to be sent to insurance. Many of them require ICD coding. A lot of medical record pruning is required. So these professionals who will be skilled and knowledgeable to do this, you don't need to be a doctor there. You can be a 12th pass person also. Somebody if you can train and create a pool of such people, because this is a back office job. You can actually go ahead and do it and create a perfect document which can be then sent to the insurance, or which can be used in case there is a legal fight or something. These records are potential research material. So if somebody can create a retrospective research facility where these records can be pruned, these records can be researched, and they can say how the trends in treatment are, and how and what kind of costs are happening for various procedures, and what kind of clinical outcomes are happening, and which doctor is better and which doctor is bad, can be a great insight to a hospital or even insurance company. And nobody's there are a lot and enough demand there. Scanning and archiving is that somebody can just scan the medical records and digitize it so that the space for the paper records can be freed. retrieval of data is another thing, because a patient may come 2 years later and it will be very difficult to retrieve that data, or somebody may be from some other hospital, and again portability of that data, if somebody can create online archiving of medical record, etc. But it has to be done very sensitively, because patients always feel that if my data goes out, it is in the open public. So you can create a customized secure database, or a local service which can help the patient. These are various aspects in documentation which could be of a huge help to the hospitals and the healthcare industry. Going to marketing and patient acquisition. Today, the time has gone when patients come from a general practitioner. Earlier, patients were sent by the general practitioner, or it used to come through a certain set of groups who used to refer the patient to a particular hospital. And earlier, there were only few referral centers of excellence. Like at some time, even people only knew about Justice Hinduja or Tata Cancer Institute. There was no Hiranandani earlier, or there was no Wokhard earlier. But now there are hundreds and hundreds of such centers, and competition is really building up. So if the hospitals depend too much on the general practitioners, then the referral fee will have no limits. So because the general practitioner would say that X hospital is paying me 20%, if you're paying me 10%, I'm not going to send to you, so you have to pay me 30%. So this will go on. So hospitals realize this, so they have to depend on patient acquisition strategy, which is other than a hospital, which is basically a direct patient acquisition strategy. Unfortunately, there is no insights into marketing, because marketing still is an unethical practice in healthcare. It was stopped for pharmaceutical industry. It will be stopped soon for the hospital industry. You cannot acquire a hospital for marketing. So how will you acquire a patient if you can't market? And marketing is very expensive. The patient acquisition strategy is very expensive. So then you have to creatively reach out to the patient directly, acquire appropriate databases, reach out to people through various other creative means, through social media propagation. There are so many aspects which leads to entrepreneurs to help hospitals and health providers acquire patients ethically, which could include continued medical education forums, patient education forums, in making doctors meet patients, patients meet doctors. There are so many ethical things which you can do. A lot of things can be done there, and this is a huge market, because hospitals want to utilize all their available bed capacity, and they don't want to leave anything vacant. Going to the equipment maintenance. Somebody inquired about what is the role of a biomedical engineer in terms of providing knowledge, what is the role of a biomedical engineer as an entrepreneur, and whether biomedical engineer himself can become an entrepreneur. It is a huge opportunity here, because I have seen this within my own hospitals, where I spent hundreds of hours training my own staff, because such insights were not there in equipment maintenance before. So it was created from scratch, and those people are now at a stage where they can go and consult others, or they give lectures outside. Such people are very few. So this leads to a huge entrepreneurial opportunity. Crores worth of equipment which are lying in the hospital are maintained by skillful people. They are because you need equipment utilization analytics. You need to know which department is misusing a particular equipment. You need to know which particular branded equipment is failing more, which equipment has a more downtime in which department. You need to have negotiation skills to acquire an equipment or buy an equipment at a lesser rate but for a higher quality. All such things are there when it comes to equipment in a hospital, and which includes end-user training of the equipment to use this, and the equipment manufacturers also look at people who would be able to do this. And this is a huge opportunity when it comes to equipment. On an average, in a hospital, there are more, say for a 100-bedded hospital, which has invested about 100 crores in their infrastructure, they would have about 20-30 crores worth of equipment, or 40 crores worth of equipment lying there. And if an unskilled person uses it, and it is unavoidable because they don't get so many such people, then it really goes for a waste. Opportunities in creating customer engagement. Now, as I said, patient is no more a patient. Patient is a customer. Healthcare is no more an emotional aspect. It is becoming a commodity. So customer wants to derive value out of what payment he's doing. So it is essential that you know what customer wants. So you need to have a patient feedback inside. You need to know what your patients were happy or not happy about themselves. Uh, you need to follow up with patient after the discharge to know what they would require further, whether they are having further problems. You need to chart satisfaction trends to be doing a course correction, because the word of mouth spreads very fast that this hospital did not take care of me well. Market surveys on requirements and changing requirements is essential to be done from time to time. And these hospitals are not geared to do all it, because most of the hospitals are either run by first generation owners who are basically doctors, or they fund a hospital where such insights are not there and they are not aware. So there's a huge opportunity lying there where you need to engage with the customer better so that the word of mouth spreads better, and then the productivity of the hospital increases. You can include home delivery of medicines, home delivery of reports, home care. There are a lot of things where the customers or the patients would require to be done. And finally, before that, there is one point which is missing is with the rise in insurance, and especially in urban setup, the insurance versus a cash paying patient is almost 40-60 now, where the TP is about 40% or the Mediclaim is 40% and the cash paying patient is about 60%. I'm talking about the urban setup. So these are the patients, these are the hospitals where you need to submit a lot of documents to the TPAs. And there is no skilled environment there. It is learning from scratch. If you can provide such ready-made staff or ready-made outsourced KPO or a BPO, these hospitals will be very happy. So this is the healthcare part. The patient also has the same problem. They'd also need to run around to follow up with their insurance company or their TPA to get their claims passed. So if there is somebody who can provide this service to the patients, again, it's a huge opportunity. And insurance is only going to rise. The total reach of insurance in India is less than 2%, but in urban setups, the ratio is about 30-70 or 60-40. So this is going to rise on a reverse ratio, and a huge skilled entrepreneurial requirement will be there to address this particular thing. And finally, in terms of the niche services, the trend is going away from the hospitalization aspect. There are newer technologies which have come in earlier for your heart problem, where you had to open up your chest. The bypass surgery had to be done. Now 90% of your heart surgeries which were surgeries earlier or only surgery options are 90% or 80 to 90% of them are done by non-invasive methods, where you don't have to cut by just putting in stents. Angioplasty is what they call. So this is an example. Technology-driven care is happening. So a lot of daycare centers where a person can come in the morning and go back in the evening. So imagine the same patient 5 years down the line had to spend about a week to 10 days in a hospital because he had to undergo bypass surgery. Now he just goes back in 24 hours, or he goes back in maybe 12 hours. So that is a kind of advancement which is there. So if somebody is looking at investing in healthcare infrastructure, a better bet is to do it on daycare services, because their episodes are better. The daycare centers are operational for a smaller period of time, so you need lesser number of staff to run a particular thing. So the equipment have become too competitive now, so it is not so expensive as it was before. So the margins have really increased. The OPD-based professional services on the rise, because patients now they don't want to go to a small clinic. They want to go to a nice branded center. So there are a lot of centers which have come up in across the country where a branded OPD clinic has come into play. There is NOAA daycare centers. There are OPD-based centers. Patient can go and get treated, where health information is given professionally. So many aspects are there. Dental care. Now, a chain of dental centers are coming in. There is My Dentist. There are so many dental clinics which are coming in, so there's a huge opportunity in that area. Cosmetic centers are coming in, where Yash Birla Evolve centers or Ayurved Shala centers are coming in. Weight loss is an in thing, which is also happening by non-invasive procedures. And if an entrepreneur or a typical or a hospital owner who he wants to come into a newer niche segment, he should look into these aspects. Tattoo scar removals. Now a lot of youngsters are doing tattoos. For example, if Deepika Padukone did RK, she may now not want that. So who will remove it? So it is a healthcare aspect. So somebody needs to have a tattoo removal center now. And implants are primarily imported, and government has created a $64 million fund now to enable people in India or manufacturers in India to open up their own implant procedures, and compulsory licenses are provided. Even if the patents are held by original companies, they still allow Indian companies to make it. So there's a huge opportunity there where a 1 lakh worth of implant can be given to people for just 2,000-3,000 rupees. So there's a huge opportunity there. People can actually go into manufacturing. Medical textiles, those gloves, meshes, disposable napkins, all such things where clothing is coming into healthcare, aprons. There is a huge opportunity there because disposable aspect is only going to rise. With increasing consciousness for infection control, this segment is going to increase like crazy. So if somebody is there in that segment, you would do very well. Ambulance and air evacuation is something where private players are coming in, and even government is outsourcing this service to them. More and more disposable incomes will want people to be evacuated from one place to a center of excellence. So air evacuation is coming in. So a lot of the Tops line has an air evacuation. A Delhi-based company has an air evacuation center. And finally, domestic medical tourism. That medical tourism, which was international, is already exploited. If somebody wants to come in to do international medical tourism, I think they will have a tough time. But nobody is exploiting the domestic medical tourism, which is already happening, but it is happening in an unstructured manner. There is Narayan Rudalaya in South, patients from Bombay are going there. There is Hiranandani Hospital in Bombay from where patients from Ahmedabad and even South are coming here. So this, based on how well it is propagated and what services and niche segments are available, people from within the country would also want to travel to various hospitals within the country, and it's a huge opportunity to facilitate this. So, ladies and gentlemen, this is what I had to say. You may post your questions. I'm available till whatever time you want.
Thank you, Dr. Akash. It was a wonderful experience for all of us, I believe. There are a couple of attendees who have started sending a thank you message for you. So I'm sure they have got a good amount of information required. As for the audience, can we start having your questions, please? So, Dr. Akash, by the time they start sending in the questions, just a quick query from my side. Can you give us an idea, starting from what range of capital or otherwise investment would be required to start a venture in this field, and what kind of time frame does one look at?
See, it all depends on what particular opportunity you're talking about. So if you're talking about creating a hospital, it takes anywhere between 50 lakhs to 1 crore or even 2 crore per bed. So if you were to make a 100-bedded hospital, you would require anywhere between 50 crores to 100 crores on an average. If you're more than 100 crores, it is said that your venture will eventually pay. Okay, so this is the hospital. Daycare center obviously is much lesser. So daycare center can be opened within 20 to 40 lakhs per bed, and many daycare centers don't even need beds. They just need recovery areas. So you just come in, get your angioplasty done, or get your hernia done, or get your cataract done, gone. So it is between about 10 to 20 lakhs per bed. And the margins there are huge. For example, a patient who undergoes a cataract surgery the lens which is put into his eyes ranges anywhere. The price, I'm not talking about the cost. The price ranges anywhere between 10 rupees to about 1,000, 2,000, 3,000 rupees. And it is sold anywhere between 100 rupees to maybe even 20,000 rupees. These are the kind of margins I'm talking about in the lenses. So imagine what kind of margins are there in eye and various such other places. Obviously, these margins are mitigated through the shares which they have to give to the doctor, the infrastructure costs, the operating theater, the air conditioning. Obviously, this is how they recover it. But there are still huge margins in such centers, and therefore, over a period of time, niche single specialty centers or daycare centers are coming up. You will see more of eye care centers coming in. Now, Vasana Eye Care has been funded by a Singapore-based company. All such things are happening, and this is going to be a trend. When you say about medical textile, is about 3,000 crore industry, which I'm talking about gloves, I'm talking about aprons, I'm talking about the implantable clothing or the textile which is put into while you're doing to cover it up with certain clothing material. So there's a huge, but it all depends on how much you can invest, and you can actually create a smaller niche to cater to various sections of those centers. And if you just want to start up a BPO, a BPO is just about 10, 15, 20,000 per seat, and you can start up from your home also. You can actually provide us, if you're not too ambitious about how much you can earn, you can actually provide these services. Now technology is existing where calls can be routed anywhere. A lot of BPOs are actually transferring their calls to housewives at their houses on their mobile phones, and nobody knows that. A lot of such things can happen, and you can provide even with least of investments to various centers. And when it is content-based knowledge, it is just a website. Everybody knows how much it takes to create a website, so there's hardly any investment required there. So there are negligible investments and there are larger investments, and I've spoken. So there's a huge opportunity, and I think in my entire presentation, the biggest opportunity is lying in equipment maintenance, which requires zero investment. It is just the human resource who would be doing this, is knowledge. Marketing and patient acquisition is again knowledge. It is about consultancy. Documentation need is not a huge investment. It is just scanners and providing digitization, etc. Quality consciousness is again consulting business, again not a huge cost. Regulatory environment facilitation, again not a huge cost, because the money will be coming from the hospital provider himself. You just need to facilitate that. It will be more of a human resource cost. IT services, yes, you would require a huge cost there. But when it comes to knowledge, providing knowledge, it does not require too much of cost, because it will be content based. And the opportunities in human resource is facilitating recruitment of staff, or helping hospitals reach out to the nurses, reach out to the doctors, so that their care continuum sustains, is not a very heavy investment.
Thank you, Dr. Akash. We sort of got the whole picture, and it was very interesting. Next question is from Mr. Jayan. I will just be putting him online. Yes, Mr. Jayan, you had a question. Mr. Jayan? Okay, there seem to be some connection issues, but he has also sent us his question, and it is something about how much does it require for setting up the same, say, a hospital kind of a setup in rural areas. Is the cost almost similar? Because he seems to have the confusion.
The costs won't change. Yeah, the cost won't change, because whether you provide the service in a rural setup or an urban setup, except depending on what equipment you want, because your cost would change from your specialty to specialty and relevant equipment. So, but would require at least 20 to 50 lakhs per bed. no matter where you do, because now the Quality Council of India is strict about the operation theatre. So no matter where you have the operation theatre, you have to follow those guidelines, which is a 15-20 page document, which would require air conditioning, which would require filtration and all those things, no matter where you do, because they have made it compulsory. Otherwise, you can't go in for that quality accreditation. Yes, power, electricity is an issue, but then you have to have a generator or a diesel generator. So all such things are there. And to help this problem, government has made setting up of centers in rural areas tax-free. Okay, so depending on where you are setting it up, depending on how many beds you have, more or less now setting it up in lower tier cities is tax-free. So that is where you will be compensating for all the higher costs.
Right. Thank you, sir. Our next question is from Mr. Rajesh. So, yes, Rajesh, are you there?
Yeah, hi, this is Rajesh. Can you hear me?
Hi, Rajesh.
Rajpal, we have spoken about a lot of things, sort of very important aspects. Like as you said, the BMI calculator or the drug doses for nurses and other aspects. This could really help out nurses, doctors in various aspects. My question is, from where do we get the data? You see, I'm an IT guy. I'm an IT guy, and I have been to various doctors. I've talked to various doctors, and I could not find time with them, and so I could not collect the data from them. I want to create a lot of applications, mobile-based applications, online applications, but I am not able to do that. So how to reach such people?
You can hire us.
All right. Okay. So when can
jokes apart, see, you can see me anytime. My email address is there on the slide. You can note it down. All said and done, jokes apart, is that yes, not belonging to a healthcare sector will be a problem. And I said that doctors really don't have time. But what you have to do is, once you've understood the concept by doing a little research or talking to certain people who can give you some time, because even those guys won't have a real insight. For example, if you ask a doctor how to calculate dose, they won't know. A nurse would know that. So if you want to make a dose calculator application, then asking a doctor would be wrong. If you ask a nurse, okay. And such dose calculations are available in open books also. For example, you go to a medical book shop and you just ask them to just try and find out through internet research or wherever, or Google it, on just dose calculations. You'll have an idea as to how a dose is to be calculated. So all such things can be done. It is not that you can't do it.
Yeah, Dr. Rajpal, that was just an example, because we tried to develop a hospital management system in the past, and we did a good job, but then then the hospital said this is not up to the mark. So I could not understand why it got failed. There were some reasons, they said, okay, this particular thing was not there, this was not there. Maybe because of some reasons, we were not able to gather the right information from them, because they were not technical. What exactly we were looking for, the information we were looking for, they were not able to deliver it actually, that information. So how to fill up this gap?
Okay, I'll tell you what, it all boils down to the cost. I don't know how much you were selling it for and whether it was a standalone application or whether it was a cloud-based application. But at the end of the day, even hospitals don't know what they want. That is the biggest irony, because they don't give importance to it. Okay, they don't give importance to it because much of their software is only related to billing. It is not related to care or electronic medical record. So you have to understand that you have to prioritize certain things. So if you can, what hospitals need today is not clinical software. What hospital today need is anything which can help them understand where their productivity is reducing, or where the costs are bleeding, or which are the departments which are more profitable, and which are the departments which are less profitable, which doctor is doing better and which doctor is not doing better, packages online, all those things. If you can create a software which is of the need, which is a priority, I think that'll sell better. And then because if you are yeah.
Sorry, please. I'm sorry, please.
Yeah, so what I'm trying to say is that before you embark on a journey of creating an HMS, you have to do some kind of a market research. You have to do a sampling of various hospitals who do not have an HMS and ask them what would they want and what is their budget. So if you ask about this, then within that budget you have to fit in certain things which they want. But if you go so and so requirement which hospital would want, whether it could be electronic medical record, whether it could be stock and inventory, whether it could be lead times, lead outs, whether it could be billing, whether it could be equipment indexing, so many things are there. But if you try and put everything, but the hospital may not have human resources to enter data there, then again it will not be used. So that is the thing. So you have to prioritize based on what your target segment or in geographical area which you can sell. If you can do a market research, especially of those people who are looking out for a software, so you can ask them what they want and then make it, then it will be good. So that is how it is. But by and large, all said and done, including hospitals which are very renowned, well marketed, even they don't use electronic medical records. They only use it for billing and stocks.
Right. So how to let them use it?
No, they will not, because the doctors don't have time. They don't have nurses. So you will have to create some kind of ergonomics or some kind of feature which will only increase the productivity and not reduce it. For example, if I'm seeing 100 patients today and you tell me to use an electronic medical record in your software, and if I'm taking 5 minutes per patient and because of this I happen to use 7 minutes, then they will never use it. On the contrary, your thing should help them see that patient in 2 minutes later so that they can see 10 more patients. So that is where the disconnect is. And these softwares have to be made keep with the doctors in hand, and unfortunately till you do that, it is a problem. So till then, whether there is an entrepreneurial opportunity or not, yes, there is a huge entrepreneurial opportunity, but the entrepreneurial opportunity is to fill the gap, not increase it. So if you're trying to look at electronic medical record, it is a philosophical gap, but it is going to take a lot of time till the human resource aspect is filled in. But you need to see that there are gaps in which people need to know insights as to where they have a problem, where their infection rates are poor, where their average length of stay is going bad, or which doctor is doing bad. You can look into those aspects which the hospitals need, which the doctor need not fill in, but it can be automatically generated just from billing, or a front office staff can enter the data. I think that is where you can leverage a lot of things.
Yes, so sir, we have another question by Dr. Dr. Subodh. Dr. Akash, you don't mind us continuing, right?
Yeah, no problem. Go ahead.
All right. We have a question from Dr. Subodh Nanavati.
So, are you there?
His question, no, he's not. We are not able to connect to him. His question is, in future, what will be the role of JCI in Indian healthcare scenario?
I see it I don't see it having any future here.
All right, sir. We'll go to the next question by Bhumika. Bhumika, are you there?
Hello.
Yes, we hear you.
Hello.
Bhumika, we can hear you. Go ahead.
Bhumika, go ahead.
Earlier, I also asked my question that how a biomedical engineer can help. Yeah, since I was unable to listen properly the whole presentation, so I request you to please kindly mail me my answer. that how can a biomedical engineer help in the whole healthcare industry, all the domains. Please make me answer because I'm not getting you properly.
Bhumika, we will be taking care of
Can
your
you hear me
query
now?
soon. Sir, I believe we will be getting back to her personally later. It seems our questions are done. Sir, any specific last message you? One last question has come up. Right. Yes, Sam. Are you there? Sam, are you there?
Yep, I'm here.
Hello?
All right. Sir, I'll just repeat Sam's question.
Yeah.
How can a techie entrepreneur connect with a MD doctor interested in a health portal?
How can he connect? In the sense, he wants to know how to reach out to him, or is he asking for some kind of a business strategy or a feature strategy? Hello?
So he's talking about reaching out. He has business strategy in place and he's a webmaster. So his question is
Okay.
about establishing contact and reaching out.
Okay. LinkedIn is the best platform. People who are tech savvy, especially in doctors, if you want to reach out to the right doctors, they need to be tech savvy. So he need to reach out only to on a tech platform. So he needs to be on platforms like LinkedIn where he can connect with them and reach out to them.
So one of our other attendees had a question very close to this, that are there any other specific, apart from LinkedIn, are there specific social networking sites for people related to healthcare?
No, when it comes to patients, they don't talk about on the social media, social network, and when it comes to doctors, they don't have time to interact on the internet. So because they see a lot of patients, whoever are tech savvy would be there either on BlackBerry, so which is not an open platform, or they would be on LinkedIn. So it is difficult. Otherwise, you will have to search for them on the internet. Otherwise, there is no specific healthcare portal for the doctors. He can go on places like the MD Consult and various niche places where the doctors go and research. So he can interact there, in the sense he'll have to get a banner or something sponsored there where people would see and then he would come in, or he will have to use Google click ads to reach out to doctors through specific keywords. But his better bet could be to reach out to doctors through the Medline search or through the MD Consult websites where doctors go and research if he wants something other than the LinkedIn.
Right, sir.
He can
I
even use just
believe.
that.
All right. I hope our attendees have got all the answers for their questions. Seems it's time to wrap up. So we, on behalf of all the attendees and on behalf of Nurture Talent, I would like to thank you, Doctor. And it was a wonderful experience for all of us. Thank you so much. All right, and for everyone in the attendees, thank you for joining us.
Thank you so much.
Right. All right, sir. Have a good evening.
Thanks. Bye.
Our, right. Our attendees can keep in touch with us on www.nurturetalent.com. We are also present on Facebook as Starpreneur. Thank you to all.